What is the diabetes? This is what you should know. Diabetes is a chronic syndrome of inheritance, almost always polygenic and not yet clarified, that must have an absolute and relative lack to the presence of hyperglycemia and other metabolic alterations of lipids and proteins. In simpler words, this chronic disease results in the increase of blood glucose levels because the product does not produce insulin or what is in the right way. For now, it is incurable, and the only way to fight it is not to neglect the treatment. Types of diabetes. Type 1 diabetes, there is no insulin, so it is necessary to administer this hormone through an injection. Among the symptoms are excessive weight loss, as well as weight loss. Type 2 diabetes, the variant of the disease, is usually more frequent than the first one, representing 95% of diabetes cases worldwide. It occurs when a sufficient quantity of insulin is produced or it is not worked in the correct way, accumulating glucose in the blood little by little. Its symptoms are not as obvious as those of type 1, which causes it to go unnoticed for a long time. People with type 2 diabetes usually also have other cardiovascular risk factors such as obesity, high blood pressure and high cholesterol. To control it, it is necessary to carry out a treatment in which medications are taken to lower blood glucose, lower blood pressure and reduce cholesterol. Of course, a healthy life with good nutrition and exercise is necessary. The diagnosis. Diagnosing diabetes is very easy because it can be detected through a fasting blood test. This analysis will be responsible for measuring glucose levels. If the figure is equal to or greater than 126 mg per deciliter in 2 consecutive analyses, diabetes is confirmed. The complications. Hyperglycemia. Levels below normal levels. His symptoms are nervousness, tremors, sweating, cold, headache and visual disturbances. Hyperglycemia. Blood glucose levels are very high. The patient has symptoms such as weight loss. Diabetic retinopathy. It is the leading cause of blindness in adults, and 50% of patients with diabetes suffer. Amputations, especially in the feet. The poor care of these wounds has caused this disease to be responsible for 20% of the amputations of the lower extremities. Myocardial infarction increases the possibility of a heart attack 2 to 3 times.